Health Matters with Karen Key.
Well, this week is World Stroke Week, and so joining me on the line this evening is Jane Herbert. She's the Professional Liaison Officer for the Speech Language Hearing Association and Senior Speech Therapist and Therapy Manager at Aurora Rehabilitation Hospital in Port Elizabeth. Jane, good evening. Welcome to the show.
Good evening, Karen. Lovely to be here.
Well, as it's World Stroke Week, let's start off with what exactly is a stroke? What happens when we have a stroke?
Well, Karen, stroke is a disease that affects the arteries leading to and within the brain. We don't have any current stats for South Africa, but it is the number 4 cause of death and a leading cause of disability in the United States. And a stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or it bursts. And when that happens, part of the brain cannot get the blood and oxygen it needs, and so it starts to die.
Now, what types of strokes are there? Because there's more than one.
Yes, strokes can be caused either by a clot obstructing the flow of blood to the brain, and then we call it an ischemic stroke or cerebral infarction, or by a blood vessel rupturing and preventing blood flow to the brain, and then we call it a hemorrhagic stroke. You might also have heard of somebody who says that they've had a TIA, or a transient ischemic attack, or a mini stroke. And that, as its name implies, is caused by a temporary clot. So the clot moves on, and the effects are temporary or very minor.
Now, the effects of stroke, I think it possibly can affect people in quite a number of different ways. Not everybody's going to have the same outcome if they've all had a stroke.
Yes, no, that's definitely the case. The brain is an extremely complex organ and it controls all body functions. So if a stroke occurs and the blood flow can't reach the region that controls a particular body function, then that part of the body won't work as it should. After a stroke, many people face communication challenges. Some people have trouble speaking, some have difficulty understanding words spoken by others. They also might be affected with difficulty reading, writing, and math skills.
Now, this is something that can be improved upon. So if you have a bad outcome initially, there are ways of actually possibly improving your situation.
Yes, most people can improve their ability to communicate, but no one can tell you just how much improvement there's going to be. Usually the first weeks and months right after the stroke, one sees the fastest improvement. But between 6 months and a year, the progress goes on, but it tends to slow down. So with ongoing effort, improvement can go on actually for years, though typically at a slower pace.
I think for those of us who watch possibly way too much television, you see things that they tell you that there's that golden hours or there's a certain amount of time. If you get to hospital quickly enough, you can almost reduce the amount of damage that could be caused by a stroke. Is that true?
Yes. No, we've certainly seen patients who have been able to get to an acute centre and have, in that golden hour, and have very minimal or no effects after treatment.
Now, if a stroke affects the left side of the brain, it leads to a whole host of complications. Can you talk us through what happens if the stroke affects the left side?
Most people's language area of the brain is situated on the left side of the brain. It's the area that links symbols to meaning. And because the words that we say and the words that we read are actually symbols for reality, that is what actually happens. When that area of the brain is affected, language, which is symbolic, is impaired. And then it's difficult to use language in many ways. You might find that people can't understand, their ability to use language changes. They can't communicate at home. They feel isolated. They can't carry on their normal leisure activities like reading and writing, watching a TV program, listening to the radio.
Now, there's more than one type of, it's called aphasia, this left side,
right,
but
yes.
There's more than one type of that as well. There just seem to be so many variables when it comes to having a stroke.
Yes, definitely. The Wernicke's aphasia, or what we call fluent aphasia, is an aphasia that affects your ability to understand, comprehension difficulties. So often people will say words that don't make sense, or they use the wrong words, or they might call a fork a glebel. They may string together a series of meaningless words that sounds like a sentence, but it doesn't make sense at all. They often think that they are making sense, but the listener cannot make head or tail of what they're saying. There are also challenges with Wernicke's aphasia because we store words in our brain, something like a dictionary, and this dictionary of words is shelved in a nearby region of the left hemisphere. So words are just not understood because the person cannot retrieve these words, the meaning of these words, from their what we call a lexical dictionary.
And then is it Broca's aphasia?
Broca's aphasia is a non-fluent aphasia where people really struggle to form words and sentences. There's quite a struggle behavior to be able to get the word out. They have difficulty forming complete sentences. They might get some basic words out, but they leave out important words that change meaning, like is and the. Sometimes it doesn't even sound like a sentence. They also have trouble understanding sentences, and they have difficulty following directions, and they have difficulty with words like left and right and under and below and after and before. And I was just going to tell you about a speech pathologist friend who mentioned to a patient that she was having a bad day, and she said, "I was bitten by a dog." And the stroke survivor asked, "Why did you do that?" In this conversation, the patient understood the basic words spoken, but failed to realize that the words of the sentence and the order of the words were critical to interpreting the correct meaning of the sentence, that the dog bit the woman and not vice versa.
Is this something that can get better, Jen?
Yes, definitely. We found that the sooner one treats people who've had a stroke, whatever the problem might be, and including speech and language, the better the chances are of recovery. We also find that just like when we have to provide accessibility into a building for those with a physical impairment, so we have to teach the families and the caregivers and the friends of the patients who've had a stroke to build ramps, communication ramps, so that we can make it easier for the person to express themselves. Sometimes it'll be through pictures, sometimes through gestures, sometimes to write or to draw. So it definitely is, even for those who don't recover much in the way of speech, we can help them to communicate and to say what they want to say.
There's also something called global aphasia.
Yes, global aphasia just refers to a very severe form of aphasia where there's an extensive portion of the anterior and posterior regions of the left hemisphere that have been affected. So these patients will have severe understanding problems, also severe difficulty producing speech. They are non-fluent and they have severe difficulties which prevent them from effectively communicating.
And then there's something, I think, lastly called apraxia.
Yes, that's verbal apraxia or speech apraxia is difficulty initiating and executing voluntary movement patterns that are necessary to produce speech when there's no paralysis or weakness of the speech muscles. So therefore it's a case of, I know what I want to say, but I just can't say it.
Now, you have some pointers for people who are caring possibly for somebody who's had a stroke and is having these difficulties. Yeah. And it's a very difficult situation, I think, for a family to be in because their loved one is no longer the person that they were possibly yesterday.
That's right.
And there are some things that we need to remember. Can you give us some pointers, Jane?
Well, remember when someone has aphasia or apraxia that you get the message across to them that you know that they know. It's not that their intelligence has been affected. There's a difference between language and intelligence. And many people think that they're not as smart as they used to be. So if we can get that message across to them, I know that you know. You're just having difficulty expressing what you know. So their problem is that they cannot use language to communicate what they know. They can think, they just can't say what they think. They can remember familiar faces. They can perhaps get from place to place. They might still have political opinions. They might still be able to play chess, for instance. But to communicate with language is where the problem is. So the challenge for all caregivers and health professionals is to provide people with aphasia a means to express what they know. And through intensive work and rehabilitation, gains can be made to avoid the frustration and isolation that aphasia can create. So when a stroke happens to a relative, friend or co-worker, please don't put them into an isolation they never asked for.
That, I think, must be the most frustrating part of all that is the person who's had the stroke is still a thinking person, is still able to comprehend and understand, just can't express themselves. And we need to remember that.
Yes.
And it is very difficult, but it is something we need to be very, very aware of, because I think it could make the situation for the person who's had the stroke that much worse if they're also they're feeling like nobody quite understands where they are. It must be very difficult, and you probably see this a lot in your work.
Yes, I do every day.
And it must be a wonderfully rewarding job when somebody finally is able to express themselves.
Oh, it is so rewarding. I just am so thankful for a profession that is just one of the most rewarding professions I think that anybody could have, to see a person who is really struggling to communicate, to give them a way in which they can get their message across.
And Jane, I think the last thing we need to leave people with is the fact that if somebody in your family has had a stroke, that's not necessarily the end of the world. They can progressively improve.
Yes, definitely. And the family and carers benefit a lot from training as well, information and ways to help their loved one.
And that would be done in places like where you work at a therapy, in a rehabilitation hospital. For example, you're at Aurora in PE. Now, you wouldn't just deal with the patient themselves, but you deal with the family members possibly and the caregivers.
That's right, yes. We train the family and train the caregivers before our patients are discharged home, and then with outpatient therapy later on, we continue working with the patient within their context, within their family.
Well, Jane, on behalf of all of those who benefit from the work that you do, thank you very much. And thank you so much for your time and for joining me on the show this evening.
And can I give a phone number?
I was going to give out the Speech Language Hearing Association number. I will give that out in a moment.
Thank you so much.
Thank you for your time,
Karen.
Jane. Good night to you.
Bye.
Jane Herbert is the Professional Liaison Officer for the Speech Language Hearing Association and Senior Speech Therapist and Therapy Manager at Aurora Rehabilitation Hospital in Port Elizabeth. For more information, you can contact the South African Speech Language Hearing Association on 0861 113 297, 0861 113 297, or you can take a look at their website. It's www.saslha.co.za.